Hi everyone, here we are again in part 4 of the gluteal injuries series. So 5 parts altogether, so do take a look at the other ones as well. So in part 4 in this video we are going to be talking about gluteal tendinopathy, which is the most common hip tendinitis and a common cause of greater trochanteric pain syndrome. Often gluteal tendinopathy will be associated with trochanteric bursitis, which causes inflammation of those fluid sacs that cushion the joint. Now, the gluteal tendons connect gluteal muscle to the hip bones, and the injury is usually a result of numerous micro tears over a course of time. So it's one of these overuse injuries that develops gradually, and then before we know it, we think, well, we haven't really done anything, but we're suddenly in pain. So tendon injuries occur in 3 areas. So they may occur in the musculotendinous junction, i.e. the point at which the tendon joins the muscle. It can happen in the mid-tendon, which is known as non-insertional tendinopathy, or it can occur at the tendon insertion, i.e. where the tendon attaches with the bone. So tendonitis basically means inflammation of the tendon. But inflammation is actually a rare cause of tendon pain. The most common form of tendinopathy is tendinosis, which is actually a non-inflammatory degenerative condition. So you've got tendinitis, which is inflammatory, and you've got tendinosis, which is non-inflammatory. So tendinosis is a non-inflammatory degenerative condition that is characterized by collagen degeneration in the tendon due to repetitive loading. Therefore, tendinopathies do not respond to anti-inflammatories because it's not an inflammatory condition. So they tend to respond to functional rehabilitation. Causes of gluteal tendinopathies. As we've said, it's a gradual wear and tear to the tendon from overuse or potentially from aging. Repetitive movements, whether it's through occupation, sport, just general daily activities, can lead to a tendinopathy. Any stress on the tendon due to heavy loads will cause small micro tears, which then encourage the inflammatory chemicals and swelling. If the stress continues, damage will exceed the rate of repair, which then starts to cause pain and dysfunction. Poor hip and gluteal muscle control that will lead to overstressing of those gluteal tendons, will cause pain and hip instability, and continued hip instability may lead to trochanteric bursitis. So there's a few sort of related sort of issues that can happen if this sort of goes unnoticed. So in terms of symptoms of these gluteal tendinopathies, lateral hip pain is certainly the main one, which can be worse sort of overnight or early morning. And if we look at this picture showing pain patterns and trigger points with tendinopathies, gluteus medius tendinitis pain, as we see here, can affect the outside of the hip, also in the buttock and the lower back, and potentially down the back of the thigh. So those red spots there are indicating areas that you're most likely to get the pain. But we can also see common trigger point areas which can cause pain. So these are those blue spots just across the top, around that sort of iliac crest there. These are hypersensitive areas in the gluteus medius muscle that can be the source of ongoing pain and reduced blood flow circulation. So certainly if you're going for a massage, these are areas that you know, can be worked on to try to reduce the pain. So in addition to lateral hip pain, another big symptom is stiffness, and again this will occur more than likely sort of first thing in the morning. It will be worse, but also loss of strength, obviously tender, red, hot, swollen areas if there's inflammation. But you may also experience sort of like a crunchy sort of sound or feeling when, you know, that tendon is in use. The pain may also worsen when you're using the tendon. So for example, if you're running, and it's also often worse when you lie on the affected hip. So the symptoms of these tendinopathies are actually very similar to bursitis. So again, you know, that can cause some difficulty in diagnosing the problem. Now, there are stages of tendinopathy which will kind of determine, you know, the recovery and sort of how effective treatment will be. So if a tendon can't adapt to the load that is placed upon it, it will progress through these 4 phases of tendon injury. Now, any progression past stage 1 can cause cell death and tendon rupture. So catching this early is actually really important in terms of long-term recovery, you know, and reducing the chance of potential future injuries. So stage 1 is known as reactive tendinopathy. So this is in the normal tissue adaptation phase. And, you know, the prognosis here is excellent. You know, if you can catch it in this stage, you know, there's not likely to have been any cell death. So yeah, this is the stage you want. However, as we've said, anything past this stage, you know, you're starting to see cell death and, you know, more extensive tissue damage. So stage 2 is tendon disrepair. So this is where the injury rate will exceed the repair rate. So the damage is happening faster than you can recover. Now, even in this stage, the prognosis is good. The tissue is attempting to heal. And, you know, if you take sufficient rest, then, you know, you should recover well. Going on to stage 3, however, this is degenerative tendinopathy. So this is where you're really starting to see cell death. There is a poor prognosis with this because the tendon cells are really, you know, starting to wear out. And then, of course, so if this continues, you're then looking at stage 4, which is tendon rupture, which is where you're seeing severe, you know, tissue breakdown, you're seeing loss of function, and you know, with this the prognosis is very poor, so your only treatment option here is usually surgery. So identifying the correct phase of tendinopathy is essential in terms of finding an effective treatment, because you know, different options will be undertaken in specific tendon healing phases. Generally speaking here, in terms of treatment for these gluteal tendinopathies, as we've said, rest is so important. Resting the painful area, avoiding any of those activities that increase the pain, you know, applying ice packs, you know, for 20 minutes at a time, sometimes as often as sort of, you know, 2 times an hour for the first 72 hours, and then just to get you through that inflammatory phase. Gentle range of motion exercises and stretching to prevent that stiffness. Physiotherapy or massage can also help with this and help with just sort of strengthening the surrounding musculature. An eccentric strengthening program is usually recommended for tendinopathies. Possibly ultrasound may help, steroid injections if the recovery is slow. So potentially, you know, if you're sort of stage 2 to 3, you may be looking at steroid injections, but of course these are only short term and you can only have so many of those. And as we've said, in severe cases, hip surgery may be required. And as we've said earlier in this video, you know, in the case of tendinopathies, anti-inflammatories may not be effective, so it's probably pointless taking those. Now, in terms of return to sport, you really need clearance by a physiotherapist to ensure that you're not going to do further damage. You should be building back to your previous level slowly, particularly again if you are in stages 2 or 3. And if it's painful, then stop and take more rest before trying again. Obviously, always ensure that you're warming up before exercise, and you can always apply ice after activity to prevent pain and swelling from arising again, and continue you know, with those hip stabilization exercises. You know, full, again, depending on the stage of tendinopathy, full rehabilitation may take weeks or potentially even months. So do take it slowly, you know, so that you don't want to put yourself at risk of sort of a worse injury. So that is gluteal tendinopathy. Feel free to comment down below. Take a look, if you haven't already, at the previous 3 videos on gluteal injuries. And of course, part 5 is coming next, which will be taking a look at the gluteus maximus, and also gluteal trigger points. As I say, feel free to comment down below. You can message me through my Facebook or Instagram. I'm on there as the Medical Massage Lady. I will come back to you and answer any of your questions. Feel free to subscribe to my channel, and you will be notified when other videos come out. But yeah, that's gluteal tendinopathy. So take care, and I will see you in part 5.